I am not a statistic, and I don't plan on becoming a statistic. Our doors will stay open because our patients need us. They need the focused and compassionate care that only community oncology can provide. My patients deserve the best chance to beat cancer, and I'm going to make sure they get it. My name is Jeff Vasurka of Northshore Hematology Oncology Associates, and I know why community counts. There's almost never a day that I wake up that I don't feel blessed that I have the opportunity to come to work and to see patients. That's been my goal since the first day I went to medical school, was to be an oncologist. Northshore Hematology Oncology has 14 medical oncologists and 2 radiation oncologists. We have approximately 220 employees that work full-time in 5 offices, which are spread across Suffolk County, New York. We see on average about 2,800 patients weekly between all of our offices. This does take into account that we're open on Saturdays and Sundays, which I know for a lot of people is a little bit surprising. But what we found is that as a community practice, to be able to be open on the weekends has made a huge difference for our patients' lives. I think unfortunately for 2013, there's a multitude of challenges that are facing us as practitioners. First and foremost is obviously the issues with Congress concerning SGR and sequestration. In addition, what has become a very troubling change in community oncology over the last few years is the shift of care from community practices to hospital-based practices. Many of my colleagues now feel no alternative or choice other than to go and sell their practice or become part of a hospital-based practice. Currently, community oncology cares for approximately 70% of the patient population and does so in a very cost-effective, very quality-oriented way. Recent evidence has shown that community oncology follows NCCN guidelines at least the same or more so than most academic medical centers. I think unfortunately, a lot of people in Congress right now don't realize the value community oncology has to us as a country. Historically, many patients, the public, as well as Congress has thought that the only place available to get good quality care would have been an academic medical center. We have now seen plenty of evidence to show that that is not the case, and quality care is available to patients right where they live in their local community with doctors who they know or who they can have access to much easier. I think what we're going to end up seeing happen is a real public outcry. When the public realizes the potential change in healthcare, their access to physicians, and the efficiencies that we've put in place could potentially go away. This practice provides an invaluable service to our community. We've been here for over 40 years. For this practice to go away would mean thousands of patients would not have access to care. When I was growing up, my mother said, if you find something that you really like and you're good at it, you'll be successful. And I think that's kind of the model that community oncology has developed. We just need everyone else to understand it. I've been very blessed in my career that I have yet to meet a colleague in community oncology that I didn't have respect for and enjoy working with. The only issue that we face today is our lack of solidarity as a group. Now more than ever, we need to work together, we need to unite towards a common goal, and that's for community oncology to survive for the next decade and longer.